आदरणीय दर्शकवृन्द नमस्कार। तपाईं हेर्दै हुनुहुन्छ हाम्रो आफ्नै टिभी। हाम्रो आफ्नै टिभीमा हामी विविध सामग्रीहरू लिएर आउने गर्दछौँ। कहिलेकाहीँ हामी ज्ञानगुणका कुराहरू लिएर आउनेछौँ भने कहिलेकाहीँ मनोरञ्जनका कुराहरू लिएर आउने गर्दछौँ। यसैगरी अहिले विश्वव्यापी रूपमा फैलिरहेको जसले महामारी रूप लिइरहेको छ कोरोना भाइरस यानी कि कोभिड-19, यसको विषयमा हामीहरूले गत हप्ता पनि एउटा नयाँ भिडियो लिएर आएका थियौँ भने अहिले पनि हामी विशेष कुराकानीका साथमा उपस्थित छौँ। हाम्रो आफ्नै टिभीका विशेष संवाददाता विवेक पाण्डे जो एमबीबीएस स्टुडेन्ट र उहाँले अति नै वरिष्ठ डाक्टर असुल अहमद चौधरी जो लामो समयदेखि अध्यापन तथा चिकित्सा पेसामा आबद्ध हुनुहुन्छ, उहाँसँग विशेष कुराकानी गर्दै हुनुहुन्छ हाम्रा विशेष संवाददाता। अबको क्रममा हुनुहुन्छ विवेक पाण्डे र डाक्टर असुल अहमद चौधरी।
Hello everyone, today it's me Vivek Pandey from Hamro Afne TV, and today we are going to talk about the COVID-19, which is the recently severe issue going all over the world. And with us we have Principal of Parkview Medical College, Professor Dr. Osul Ahamad Chaudhury. Let us welcome him to the program.
Now today we shall talk about coronavirus. This coronavirus is now sweeping the world. But is this coronavirus common to us? Yes. The coronavirus is actually a common virus which circulates throughout the world, and from human being to animals this coronavirus is common. But this coronavirus, which is now causing havoc throughout the world, is a new one. Now, where it emerged? This new coronavirus, if we look back, in December 31st, 2019, WHO was alerted to several cases of pneumonia in Wuhan city, Hubei province of China. And that virus, though this is a coronavirus, it did not match any other known virus. This raised concern because when a virus is new, we do not know how it affects people. Now 1 week later, on January 7, the Chinese authorities confirmed that they had identified a new virus. And the new virus is a coronavirus, which is a family of viruses that include the common cold viruses such as SARS and MERS virus. This new virus was temporarily named 2019 and coronavirus. Afterwards, WHO named it COVID-19 or coronavirus disease 19 virus. And coronavirus is a single-stranded RNA virus, non-segmented, and the related coronaviruses which circulate in human communities are no less than 6. They are 229E, OCA3, NL6, HKU1, and the much talked about SARS coronavirus and MERS coronavirus. So those are the families of coronavirus. Now, what sign symptom of this coronavirus infection, that is the COVID-19 infection? Now, the common signs of infection include respiratory symptoms such as fever, cough, sneezing, shortness of breath, and breathing difficulties. In more severe cases, we can go find infection can lead to pneumonia, severe acute respiratory syndrome, that is ARDS, kidney failure, and even death. How this virus is transmitted? We know that WHO has declared a global emergency. The transmission is important because depending on this, we'll suggest preventive measures, how it transmitted. It is transmitted through infected people's coughing and sneezing, by touching an infected person's hand or face, or by touching things such as doorknob that infected people have touched. So by this time we know how it is transmitted. In personal level, hand hygiene is extremely important. What do we mean by hand hygiene? That is frequent washing of hands with soap and water, if sanitizer is available, or if, for example, if anything is not available in this type, then a simple hand washing with water can go a long way in preventing this disease. Then comes respiratory hygiene. In respiratory hygiene, now it is suggested the social distancing. That is, people while talking, they should not handshake. They keep themselves at least 1 meter away from one to another. In some countries it is suggested 2 meters, which may not be practical. And whenever someone is sneezing or coughing, he or she use tissue paper. But that tissue paper should not be thrown away. That should be disposed of properly. Another factor is food hygiene. That is, food should, it is better to consume food which are heated or thoroughly washed. Another one is to avoid mass gathering, because in mass gathering we know that if someone is infected, he or she can spread it to people nearby him or her. Travel restriction is another important point. One should restrict or cancel all non-essential travels. Some countries imposed up till now total restriction on travels. Even you should cancel non-essential doctor's appointment, because in doctor's chamber a patient may be there sitting with coronavirus infection. So you should avoid attending doctor for trivial things. You can take help of doctor through phone, telephone or mobile phones, etc. Countries have imposed, for example, airport temperature screening methods, which are now in place in Bangladesh even, and different countries of the world, to screen people who have got higher temperature and sort them out and examine them properly, and if required, they can be quarantined. Another preventive measure is school closure. This has been tried in different parts of the world. Regarding treatment, we know that there is no specific treatment up till now. Treatment are symptomatic, and treatment of pneumonia, supportive treatment, ICU measures, etc., all these things, and ICU patient. But we have to remember that most of the cases are either asymptomatic or mildly symptomatic, so they do not require even hospital admission. Those people who are severely ill require ICU support, etc., they require hospital admission, but not all people. Minor symptoms, they should stay at home. It is better for them to stay at home so that the community can be protected in this way. Another question may come that why up till now, that is what we have not seen a vaccine yet. Now the problem with vaccine is manifold. One of the most difficult things is to develop a vaccine. It is time consuming, regulatory agencies are very strict about this, because you are giving vaccine to healthy people. You are not treating an infected people. You are giving vaccine to healthy people. So you must have to ensure its safety first. Whether the vaccine is safe. The next you have to assess its efficacy. Is it effective? So these two questions must have to be answered first. Is it safe? Is it effective? So this require actually trial. First of all, you require an animal model where the same type of disease develop, so that you can assess the efficacy of the vaccine. But fortunately, we have animal models which are developed during SARS epidemic, that this is SARS virus infection, and the scientists are trying on this, and after that animal trial we go on human trial. First of all, the voluntary, a small group of trial. If it proves to be safe and effective, then we go for larger trial. So it requires time. That's why automatically a vaccine development requires 1 year to 1.5 years. Previously, we saw two deadly viruses similar to this. One is MERS virus, another is SARS virus. But with meticulous attention to public health measures, we have contained those viruses. And now they are not seen, this MERS virus and SARS coronavirus. And we are confident that we will be able to contain this virus also. And if vaccine become available, that will be an added joy for us to fight against this deadly disease. But we must remember that this virus, its mortality is actually low. This is around 4%, but in lower age group it is far less than that. In children it is far less than that. But problem is that when large number of people become infected, the number rises. For example, if 1 crore people become infected, then the number of deaths will become high. And this virus has the potential to infect large number of people. That's the danger lies. So,
wearing mask is beneficiary or not?
A question has been raised whether a mask is beneficial or not. Actually, if we look into scientific evidence, the scientific evidence regarding large-scale use of mask is lacking. But as we have not yet know many more things about this virus, and this virus is emerging, and the mask can prevent a person from transmitting his infectious, that is his infectious respiratory infection. So it is important, if someone is suffering from respiratory infection, he should use mask. But widespread use of mask in public places has not been recommended. But in close gatherings, one can use mask. Regarding the pathogenesis of disease, this is actually, the pathogenesis of disease has not yet been delineated closely, but it affects the respiratory epithelium, and the respiratory epithelium becomes swollen in general terms, and it what the pneumonia did, that is the transmission of oxygen become hampered. In simplest term, this is the pathogenesis. Another question is put, what should be done in COVID infection if someone become infected? If someone suspect that he or she is infected, in our country he or she should contact with, there is a hotline provided by IEDCR. One should contact them, and if the symptoms are suggestive of COVID-19 infection, they will suggest further measures, whether you are to report them to them, but they suggested that you should not directly go to them, that is IADCR office. You should first contact through hotmail, that is hotmail number, hotline, and if they suggest, then you go to their office, or in serious cases they even can collect samples from home. Thank you, Mr. Pandey.
आगामी दिनहरुमा पनि यस्तै विशेष भिडियो विशेष जानकारीहरु लिएर हामी हाम्रो आफ्नै टिभीमा आउने बाचा गर्दछौं र तपाईहरुलाई कस्तो खालको भिडियो आओस्, अहिलेको महामारी छ कस्तो खालको भिडियो चाहिँ हाम्रो आफ्नै टिभीमा आइराखोस् भन्ने चाहनुहुन्छ, कृपया सो प्रतिक्रिया आफ्नो कमेन्ट मार्फत दिनको लागि पनि हार्दिक अनुरोध गर्दछु। कीप वाचिङ हाम्रो आफ्नै टिभी। थ्यांक यू।